Good afternoon, everybody. My name is Ashish. I'm the Dean of the School of Public Health, and alongside Jack Elias, who's the Dean of the Medical School, who could not join us today, I want to welcome you to this series. This series on decoding disparities is a joint effort between our two schools to focus on disparities, on inequities in healthcare and health, and how we are going to tackle them. So I have just finished up my first month as Dean of the School of Public Health at Brown, and I want to start off on a personal note saying how thrilled I am to be here. And this joint effort between our two schools really comes from a long-standing commitment that has existed at both the medical school and at the School of Public Health to tackle these issues that are in front of us. And I want to take a minute to talk about these issues. So disparities in health, health inequities, have been with us since the founding of our country. It's been ingrained in our nation, deep inequities based on race and ethnicity. And while they have been with us for a long time, and while we have made some progress on these issues, I think what we have seen over the last few years, and certainly over the last few months, especially in the middle of this pandemic, is those inequities come into sharp relief. I think we now understand how deep they are, how pervasive they are, how much underlying systemic racism plays a role in creating the context for these disparities, and how the work to make progress, to bring people together, to close the gaps is more urgent than ever. And so one of the questions that our leadership at our school, alongside the leadership of the medical school, asked was, what else can we be doing? And how do we work together? And in that effort, what has happened is there's a series of things that we're going to be doing together. But this series of lectures that we're kicking off today is part of that effort. And the reason is that we are ultimately a scientific community. We are a multidisciplinary scientific community. And what we can bring to bear almost more than anything else is a scientific approach that really helps us bring evidence and data and science to these complex problems. So that has been the motivation behind this series, that how do we use our tools to begin to make progress on disparities and inequities in health. And we are going to start off today, and I'm not going to get to chances to introduce our speaker, who is from UCSF, where I spent many, many years. I'll leave that to Dr. Rounds in a second. But I want to talk for a minute about the professorship that is supporting today's lecture, and that's the Paul Levinger Professorship in the Economics of Healthcare, founded through an endowment established in 1987 to honor the memory of Paul Levinger. The gift was made possible by his late wife, Ruth Levinger, their daughter, Betty Levinger Cohen, and her husband, Dr. John Cohen, a pediatrician who was Brown class of 1959. We're always so pleased that Betty and John have been regular attendees at the Levinger Lecture over the years, and would like to extend a special thanks to them and their families for their incredible generosity. It really is support like that that allows us to do this kind of work. Let me tell you a little bit about Mr. Paul Levinger. He was the president and treasurer of the Spidell Corporation. He was a member of the corporate board of both the Rhode Island Hospital and Beth Israel Hospital, and was also president of the Miriam Hospital. In 1969, he received an honorary doctorate from Brown. So he has a long-standing set of relationships with Brown University and with Rhode Island. Mr. Levinger's Spidell building, located at 70 Ship Street, is now our laboratories for molecular medicine. And what is really amazing about that as a symbol is that it is really about two generations of Providence, one bringing the old Providence into the modern era through being a place for biotechnology and healthcare. So before I go on, let me just take one more minute to also recognize the efforts of Sharon Rounds, who is the Associate Dean for Clinical Affairs, David Williams, Director for the Center for Health Promotion and Health Equity at the School of Public Health, as well as their teams for making it happen, as well as Dr. Carolyn Kuo, who's the Dean for Equity and Inclusion at the School of Public Health. There's a whole team of people who've come together to work on this series, and I am incredibly grateful that they have. Today is just the beginning. We're going to have a whole series of lectures throughout the fall. We will continue into the spring, and my hope is at the end of this, we will all be smarter and more knowledgeable. We'll have a better understanding of where we need to make progress, and also what still needs to be learned. And that ultimately gets us to today's lecture. And before I go any further and turn it over to Sharon, let me just say on a personal note, this issue of climate change and its effects on health has been one that I have personally been passionate about over the last decade, having come to believe that health effects of climate change will ultimately move our country and the world towards action. And when you look at the health effects of climate change, they disproportionately affect the most vulnerable among all of us. And so without much further ado, let me turn it over to Dr. Sharon Rounds, who's going to introduce today's speaker. Sharon.
Thank you. So on behalf of the Cardiopulmonary Vascular Biology, COBRI, and Brown investigators in respiratory diseases, it's my great pleasure to introduce our inaugural speaker in the Decoding Disparities series. John Balmes is professor of medicine at University of California, San Francisco, and also professor of environmental health science at UC Berkeley School of Public Health. He's a staff physician at the Zuckerberg San Francisco General Hospital, and I'm proud to say that I'm an alumna of that internal medicine training program. He trained in New York at Mount Sinai and pulmonary critical care at Yale. He then headed west and ended up at the University of California, San Francisco, where he led groundbreaking work demonstrating for the first time that environmental ozone exposure worsens asthma in humans. And this was an extraordinarily important research that really focused us on the true effects of the environment on lung health. He directs the Northern California Center for Occupational Environmental Health, and he's the physician member of the California Air Resources Board. So as you can well imagine, he's been very busy the last few weeks with the challenges that the state of California has faced with wildfires. I am really pleased and honored that he's able to talk to us today on the climate gap. I would ask the listeners to please put your questions in the chat, and we will respond to them after John has finished talking. And a very warm and hearty welcome to you, John. We're so pleased that you could join us today. Thank you.
Thank you for that warm welcome, Sharon, who I've known for many years as a fellow pulmonologist, and it's great to be introduced, to be the inaugural speaker in this important series that Drs. Jha and Elias have put together in terms of decoding disparities. I'm going to take a little liberty with being the inaugural speaker, and that I will talk about the climate gap and how climate change increases health disparities, but I'm going to speak about environmental justice in general initially. And I'll start with the changing demographics in our country, which we see very dramatically in California. I imagine you're seeing also major demographic shifts in Rhode Island. And we're rapidly becoming a majority nation of color. And that has to change our conversation about many things, including environmental policy. And unfortunately, even though we're having an increasing percent of the population be of color, we're still very segregated. There's been very little progress in terms of racial segregation in US cities. I'm from Chicago originally, one of the most segregated cities in the country, and it really hasn't changed much during the 70 years of my existence. And I like this slide. I don't have time to go into it in detail, but the point of this slide is that the inequality that I will be talking about in terms of environmental exposures and climate change in particular is bolstered by a political system that basically rewards the wealthy and disadvantages people of color and people of low socioeconomic status. I mean, to put this slide in a nutshell, it's not poor people that drive Teslas. It's not poor people that usually have access to solar power, though they may be lucky enough to live in low-cost housing that has solar power. And this income inequality and access to power reinforces environmental injustice. And so there's been a push for several decades for environmental justice to redress the disadvantage and disparities that environmental injustice has caused. So it's important for us to consider how social inequality is linked to environmental degradation and health disparities. Basically, if I could sum up the slide in just one phrase, is that place matters. There are multiple hazards where communities live, work, and play. And those same communities tend to be disadvantaged due to chronic social stressors, such as poverty, malnutrition, discrimination, and a disproportionate burden of chronic health problems. And my close colleague, Rachel Morello-Frosch, matter of fact, she's going to be teaching in my class at UC Berkeley School of Public Health on environmental justice and environmental racism this afternoon. And she was at Brown for several years before we were able to lure her back to UC Berkeley. She came up with this concept of triple jeopardy of social inequality. And so we have three baskets here: disparities and exposures, then social vulnerability. These are extrinsic factors, extrinsic to the person, with regard to neighborhoods that are characterized by poverty, food insecurity, psychosocial stressors, poor healthcare access, chronic racism. And then there are biological susceptibility factors such as age, underlying disease, malnutrition, and sex. Together, these three baskets of risk lead to health disparities in both mortality and morbidity. And you talked in a previous series about disparities related to COVID-19, but it applies to virtually any disease you can come up with. And so I do work in Richmond, California. It's an industrial city just north of Berkeley, where I'm talking to you from. And I'll show this slide again for context. But here, where that Pentagon is a low-cost, affordable housing. It's actually public housing that's actually in relative disrepair. And you can see that these people of color and low socioeconomic status are exposed to downwind refinery emissions from a very large and old and dirty refinery, an associated chemical company that uses refinery byproducts to make chemicals, a port. There's actually a major interstate, but also the Richmond Parkway is an interstate equivalent, and there's a rail yard. And a lot of these emissions are diesel, but there are other toxic air contaminants as well. And you can see that this community is basically surrounded by environmental hazards. And so this gives rise to a concept of riskscapes, that industrial and land use development shapes the mosaics of communities and workplaces, again, where people live, work, and play. And these patterns are usually racialized or segregated by class, with disparities in exposures as well as other types of stressors. And these riskscapes affect distributions of people and pollution and the effects of climate change. So just a little bit more about this exposure inequality. People of color and low SES have greater exposures to outdoor air pollution. This is well documented. This isn't just me spouting off, from a political viewpoint. There are hard data across the country, and we have very good data in California that show that these communities of color and low SES have greater exposures. They also have disproportionate proximity to polluting land use and toxic emissions. They don't put refineries, they don't put rail yards, they don't put power plants in rich white suburbs. And then poor communities have more health damaging factors and less health promoting amenities. Just a few examples, this is not an exhaustive list. There's more fast food and more liquor stores in these communities. It's well documented with solid data. And there's less green space and recreational programs. And this inequality curve was generated by, again, Rachel Morello-Frosch, former Brown faculty and colleagues at the School of Public Health. This paper from Environmental Science Technology in 2009 won the Best Paper of the Year award. And they used this concept of the inequality curve. On the x-axis, we go from most disadvantaged to most advantaged with regard to either race, ethnicity, or socioeconomic status. And on the y-axis, the cumulative share of environmental hazard in terms of exposure. And this red line would be the equality line if exposures to environmental hazards were equal between rich and poor and white and color. And of course, it's this negative inequality line, the dashed line, that's the reality. And they, in the same paper, used LA County as sort of a test case. And you can see three maps of LA County. The A map is the non-white population, the darker, the more people of color. The B map below is a poverty map, overlaps pretty nicely with people of color. And then the map on the right is a cumulative hazard map. And they used two different traffic-related exposures in this test case of their concept. And it's diesel exhaust particles and oxides of nitrogen, nitrogen dioxide primarily, which are very good markers of traffic, including heavy-duty vehicle traffic. And you can actually see freeways on this map, but you can also see it's the inner city where people of color and people of low socioeconomic status reside. And so I'm sure, since many of the audiences in the School of Public Health, that this isn't going to be really new information, but I like to use a socio-ecological framework when I think about health disparities, going beyond the biomedical model that I was taught in medical school at Mount Sinai, and later at Yale as a pulmonary critical care fellow. And on the left, we see the many different layers of risk factors that impact an individual in terms of their health. And host level factors, I think, are actually often vastly overemphasized in our biomedical model. These other 5 layers of risk are actually often more important. And then you can see how biology, environment interactions lead to adaptation or disruption and disease risk. So the concept of cumulative risk is one that I've incorporated into my own thinking and research and policy making on the California Resources Board. Health disparities are really a consequence of race, ethnicity, and low SES. Inequality of exposure to environmental hazards is one of the ways that these health disparities are related to race, ethnicity, and low SES. We've already talked about that. There's increased risk due to individual level factors because the individual level health of people who live in communities of color and low SES are often worse. There is less good access to a healthy diet. There are psychosocial stressors living in neighborhoods that may be more dangerous, may have less amenities, as we've talked about. And then there's increased risk due to community level factors, which I'm already moving towards. So the concept of cumulative risk has been developed to capture the interplay of these factors on health disparities. I'm kind of repeating myself, but education is an iterative process, and I want to make sure I drive this message home because I think it's incredibly important. And I think that's the driving force behind this Decoding Disparities series, which I'm proud to be speaking in. So the community level factors, to get a little more detail. So there's differences in risk related to exposure and other extrinsic social stress factors, such as occupational exposures, crime, violence, lack of community resources, crowding, access to healthcare, poor education, poverty, and segregation, which I think since the George Floyd murder, we really started to appropriately focus on the chronic health effects of discrimination. And, you know, low SES and racial ethnic discrimination have been linked to both perceived stress on individual level and biomarkers of chronic stress. There are real biological effects, disease effects from these extrinsic factors. And for example, I'm an asthma researcher, exposures to family stress and violence, 2 separate studies, one from Southern California with regard to family stress and one from Boston on violence, showed that the known risk of new onset childhood asthma from traffic related air pollution is exacerbated by coexistent exposure to these psychosocial stressors. So a little bit more on structural racism. So this is a map of Richmond, California. I showed you the a photo from a helicopter of Richmond. Here's a map, and on the right side to the east, we have neighborhoods in green, especially the dark green, and then we have areas in red. And the areas in green are largely white and wealthy. The areas in red are Black and Latinx and poor. And there's a 10-year difference in life expectancy going from the green, the dark green to the red. This is a stark visual display of health disparities. Now I'm going to move south to Alameda County, where I live. It's just south of Richmond. And you can see West Oakland here in dark. That's the emergency department visits for kids 5 to 17 in Alameda County. And West Oakland has the worst or the highest rate of childhood emergency department visits. And that same area is also the poorest in Alameda County. And then moving to air pollution, it's also the area with the greatest air pollution. And discerning minds might actually think there might be a connection between air pollution, poverty, and race ethnicity. And these differences in both Richmond and in Alameda County relate to structural racism. There's a legacy of redlining, which many of you may have heard of. So to get people out of debt in terms of their homes, to save people mortgages in the end of the Depression and through the 40s, there was a federal program to provide low-cost mortgage loans to people, but there were assessors that were sent out to assess risk, in quotes, for these mortgages. And it's called redlining because the areas in red, this is West Oakland here, which I showed you before, were people, primarily Black people at that time. Now these neighborhoods also have a lot of Latinx residents. But these neighborhoods, people were not able to get home mortgage loans, as opposed to the green areas where these were rich white areas where there was no risk, in quotes, to loans. And if you study this, it was directly racist, the language that the assessors used to determine red line neighborhoods. And I've recently been able to study with colleagues at the School of Public Health at UC Berkeley, and Anitha Thacker is at UCSF in pulmonary with me. We looked at historical redlining in California and the 8 largest cities in California, and looked at current emergency department usage. And there's a nice, actually not so nice, step function in terms of ED utilization in these communities related to their federal mortgage loan risk grade, from low risk to the red line neighborhoods. And why is this? It's because legacy wealth in this country is largely based on land, on homes, and people, even middle-class folks in these red line neighborhoods, were not able to get low-cost loans in the 30s and 40s. So there was like a permanent deterioration of this economic deterioration of these neighborhoods, which has persisted to this day. So when people talk about structural racism, redlining is right at the top of policies, federal policies that created these disparities. Now I'm going to switch gears to go to climate change, which was what I was supposed to talk about. And I just used a California slide here. So right now, we know we have warming. And if we get our act together, which we're not doing, and this is globally, to reduce greenhouse gas emissions, we'll only have a few degree rise, but we're on a path towards higher emissions. And so we're, as many of you know, in trouble in terms of our degradation of the climate due to warming, greenhouse gas emissions. And then by the end of the century, we're in big trouble if we don't get our act together. And one of the effects of climate change, of warming, is higher temperature. And well, which increases the amount of ozone that's in the air. Ozone is directly created from rush hour motor vehicle emissions, among others, in the warm, sunny afternoons in California and elsewhere. So we have high ozone levels in the afternoon, and there is a very nice linear relationship. This is in Fresno, California, in the middle of our San Joaquin Valley. It gets very hot already. And these are real data showing the warmer it is, the higher the ozone level. But it's not just Fresno where there's a problem. In other areas, even more temperate areas like the Bay Area, we're going to have increased ozone levels due to warming. And we have very strict environmental policies in California to try to reduce ozone emissions because we have the worst ozone air quality in the country. And without warming, we'd have pretty impressive reductions at all 4 of these locations. But there's a so-called climate penalty because of the warming. So our combined effects are not very impressive, even though we're spending hundreds of millions, if not billions of dollars to reduce ozone emissions. And there are major health costs due to this increased ozone. And it's not just ozone, it's also nitrogen dioxide and particulate matter that's generated because of increased electricity demand to adapt to the warmer temperatures, more air conditioning. And so wherever it's red here is where there's increased electricity demand, up to 50% more to try to adapt to the warming temperatures. And again, who lives in the Central Valley in California? A lot of poor people of color. And so rather than show you polar bears on shrinking ice flows or shrinking glaciers or rising sea level, I focus on this one American Lung Association slide that shows the health effects of climate change. We've talked about ozone increasing. We've talked about particulate pollution emissions from increased energy use. What we haven't talked about are increased asthma and allergy exacerbations due to the combination of higher levels of ozone and increased pollen exposures with changing growing season. I myself have done some studies showing that ozone and allergen co-exposures lead to greater exacerbations of asthma than either one alone. Heat waves, we just got through a heat wave that was very painful because we also had to keep our windows closed because of poor air quality due to massive wildfires. And all of these factors lead to increased hospitalizations and premature deaths, especially among vulnerable populations, the point of this series. And so the climate gap has been, is a term coined to capture the increased vulnerability of communities of color and low socioeconomic status who bear the brunt of the heat island effect, where it's warmer in central cities without green space. Trees and parks reduce the actual ambient temperature in urban areas. And then these same folks are exposed to multiple sources of pollution. They may not be able to afford air conditioning, and then they have lack of access to healthcare, transportation, and services. And there are data going back over a decade in this regard. This is from a set of California EPA investigators. Rupa Basu is the first author. And they showed back in 1999 to 2003, a long time ago, in terms of climate change effects, that Black folks had a higher risk of heat-related mortality than either white or Latinx. And this is a study from Harvard, which showed that this increased mortality among Blacks related to heat, also related to air conditioning prevalence. And you can see here that Blacks in all four cities, Pittsburgh, Minnesota, Minneapolis, Detroit, and Chicago, had greater risk of mortality from heat-related illness and also lower prevalence of air conditioning. I'm from Chicago. I know how hot and humid it can get in the summer. Again, it's socially isolated, poor Black folks that have died during heat waves in Chicago. Now I want to move into what California is doing to try to address climate change, air quality, and environmental justice. And so I want to start by saying the major sources of greenhouse gases, which are warming our climate, and aerosols, black carbon is a climate forcing aerosol, they also contribute to poor air quality. And so California, we're known for our strict environmental regulations. I'm proud of the fact. And in 2006, Assembly Bill 32, the Global Warming Solutions Act, was passed. It was just before I joined the California Air Resources Board, but this mandated a price on carbon to reduce emissions of greenhouse gases. Talk more about that. It established a greenhouse gas emission cap for 2020 that was based on 1990 levels. And it meant a roughly 25% reduction from business as usual, because between 1990 and 2006 and on to 2020 projected, there were increased greenhouse gas emissions as the population and economy grew. It required a scoping plan to figure out how we're going to achieve these 2020 targets. And 2020 compliance is expected. We're on target for that. But then the legislature passed in 2016, 10-year anniversary of the Global Warming Solutions Act, an even more ambitious plan to have a 40% reduction from 1990 levels by 2030. This is a heavy lift. And so Assembly Bill 32 has led to a paradigm shift in terms of how we do environmental policy in California. All regulations that the California Air Resources Board puts out are evaluated regarding both climate change mitigation and health co-benefits. So a focus is now on emission reduction rather than ambient air quality. This is a difference than how the federal EPA does. The federal EPA regulates regional air quality. Matter of fact, they put the monitors away from point sources like power plants. We are now able, with this integrated policy, to focus on local sources of emissions. So our California Air Resources Board regulatory paradigm shift has led to a focus on emissions reduction that can lead to new technology and economic stimulus. And this is to counter the anti-regulatory job killer rhetoric of the current administration federally. And we've been able, until the COVID-19 pandemic took the wind out of our economic sails, we were growing our economy despite having very strict environmental regulations, both in terms of solar power. And here's a photo of the Tesla manufacturing plant in Fremont, California. I told you that we're charged with putting a price on carbon. This has an environmental justice impact. That's why I'm telling you about this. So cap and trade is one approach. It's what we actually adopted. It caps carbon emissions, but the price of carbon fluctuates. There's a market that's created to achieve this cap. And it's so because there's a market and that people can cheat and speculate, it's complicated to administer. Most economists like carbon taxes better. They don't have a cap on carbon emissions, so you have to get the price right. There's variable carbon emission reductions, but there's a fixed price of carbon, which makes them simpler to administer. At least in California, any kind of tax takes a 2/3 majority of our legislature, so it's politically difficult. And I was appointed by Governor Schwarzenegger back in December 2007, and when I was being vetted, and I mentioned that I favored a carbon tax for a price on carbon, I was told that I better not ever say that again if I wanted the governor to go through with my appointment. Governor Brown, to follow, let us talk about a carbon tax, but he wanted to stick with cap and trade, which I believe Governor Newsom also wants to continue. So what is cap and trade? A cap limits total greenhouse gas emissions from regulated sources. That cap declines over time, so you ratchet it down to get ever increasing reductions in emissions. The state sells emission allowances. You actually have in New England a cap and trade program for power plant energy emissions. It's called RGGI. Works very well, but ours is not just power, it's all sectors of the economy. And participants are allowed to trade allowances. This creates flexibility, reduces cost of compliance. So a dirty facility like that Chevron refinery I showed you, it would cost a lot of money to reduce its emissions, so they can buy emissions from a cleaner company. So here's a cartoon of how it works. So a clean company like Kaiser Permanente, which is a healthcare mega company in California, they've been very serious about greening their emissions, so they have leftover allowances to sell. They can sell those allowances to Chevron, so Chevron doesn't have to spend a lot of money to clean up. They have to spend money to buy those allowances, but it's still maybe cheaper. And I think many of you will understand that that has an environmental justice concern, because if they don't have to clean up their greenhouse gas emissions, they'll keep polluting toxic emissions that will harm the neighborhood nearby, the neighborhood I showed you before. So to address the environmental injustice of cap and trade, various things have been tried in California. The first thing was we tried to buy off people, poor communities of color, through an investment justice approach. Through the state sells allowances to emit greenhouse gas emissions. You know, we've sold over 10 billion in the last few years. So the state has made a lot of money from these emission allowances that are being sold. And so there was an assembly bill that required that 35% of the revenue be spent on projects that benefit disadvantaged communities. And that we actually developed a mapping strategy to identify disadvantaged communities. This is actually, we're about to go into CalEnviroScreen 4.0, but this shows how we took both exposure metrics, and not just air pollution, but water, pesticides, et cetera, and then population characteristics to capture the other two parts of that triple jeopardy that I talked to you about, to map the most disadvantaged communities in California. And they're primarily in the Central Valley of California and down in the Imperial Valley at the southernmost part above Mexico. Now, you know, some of the, I don't want to just be all doom and gloom. So, you know, one of the ways that we've spent money to improve situation for disadvantaged communities is urban forestry and urban green space development. So a fair amount of money has gone in to try to improve access to green space in disadvantaged communities. We've also provided subsidies for solar power, efficient appliances, and subsidies for zero emission vehicles. But the environmental justice advocates that were upset with cap and trade, wanted a carbon tax in California, actually went so far as to work to study the environmental justice implications of our policy, cap and trade. And you can see from this slide that the number of greenhouse gas emitting facilities, so these are like refineries, cement factories, the more of these, there are greater prevalence of these in communities of color and also communities of disadvantage economically. So the environmental justice folks were right. Cap and trade potentially disadvantages disadvantaged communities all the more. So just bringing you back to Richmond again for context. Richmond is a community that actually is now being part of an ambitious strategy, which I'm going to tell you about in the next few slides, to directly address environmental justice in California. Assembly Bill 617 was passed, which mandates my agency, the Air Resources Board, to develop guidelines for community air quality monitoring. It requires local air districts to work with communities to identify where to put air monitors and to identify local hotspots of exposure. And then once those results of community air monitoring are available, to design community emission reduction programs. And this is with community partnership. And there's actually even funds for the community groups to get technical support to work with the air districts. And this is a cartoon of how it's supposed to work. You know, community level air quality monitoring should lead to community emission reduction plans and accelerated retrofit of pollution controls on industrial facilities. There's also a provision for enhanced emissions reporting that the public can understand, to empower them to make to lobby for policy actions, increase penalties for polluting facilities, and oops, I keep doing that. And there are dollars to support these community-based efforts. And I just want to show you that California has been trying hard to address environmental justice. This is showing both PM 2.5, fine particle pollution trends in environmental justice and non-environmental justice communities. And there's progress has been made, but there's still a disparity. With ozone, which is a regional pollutant that affects white suburbs as well as disadvantaged communities of color, we have much more equality in terms of exposure. And then our greatest source of emission disparities is from diesel particulate. And here you can see that we're making progress, but we have a further to go. So I want to end with a quote from one of my mentors, David Bates, former dean of School of Medicine at UC, University of British Columbia. And I had the pleasure to collaborate with him on a newsletter. And he died shortly after this newsletter was published. But he talked about the interaction between emissions of air pollutants that we need to slow global warming and minimize releases of greenhouse gases. You know, both of these would save lives that would be lost to pollution, especially in disadvantaged communities of color. And a well-inclined government generally committed to sound science would recognize this and assemble a package of policy measures for our health and our future. Some governments are at least attempting to do this. I'd say that's true in California. Hopefully in Rhode Island, most are not. So my last slide, the sources of air pollutants that harm health are the same as those that emit greenhouse gases and aerosols. Poor people of color have disproportionate exposures. To improve public health and mitigate climate change, we need strong policies to move our economy away from reliance on fossil fuels to reduce hotspots of exposure. We need clean power and clean transportation. Thank you.
Bravo. Let's see.
I'm happy to try to answer some questions.
Great. So I asked the participants to put their questions into the chat function, but I'm seeing a admonition from Media Services to put it in the Q&A button. So I guess we'll look at both.
Well, I can start off with responding to my longtime colleague, David Eggleman. Yes, and he says, the science is clear. How do we translate the science into policy will garner the support of Trump voters and the rich who are now affected by fire and hurricanes? Well, David, I would say in California, where we have as great of disparities in terms of wealth and health as any place in the country, that the question is relatively settled. You know, the wildfires that we have really, I think, convinced most people, not everyone, but most people that the science is clear and we need to move in terms of policy. And we actually had a vote a few years ago, actually before the bad wildfires, where the forces of darkness with regard to clean power and clean transportation actually put a state referendum before the voters. They called it the Job Saving Act. I'm not getting it exactly right. And the voters overwhelmingly supported continuation of AB 32, our Global Warming Solutions Act, without any kind of breaks. And we've just pushed forward since then. Now the whole country is in California, but I do think that hurricanes and floods and wildfires get people's attention.
Is there data yet on the effects of wildfires in different communities?
Yes, I mean, the wildfire smoke blankets regions, so rich and poor, white and people of color get exposed the same in a certain sense. The air quality is the same. But just like COVID-19 disparities, I'm, a relatively well-off white professor. I can stay sheltered in place in my comfortable Berkeley home. I can work remotely. I don't have to go outside except when I have to go into the hospital. Whereas essential workers, people delivering our food, all those Amazon deliveries that we order, they're out being exposed to wildfire smoke. And then in California, especially, our farm workers, the crops still have to be tended to and harvested. And when the wildfire smoke in wine country was terrible, very unhealthy, hazardous even, there were winery workers out there, picking grapes. And then there's also the homeless folks, of which we have many in Northern California, who can't shelter indoors. So yes, wildfire smoke exposures are also affecting people disproportionately. And I've been asked to speak a lot on media about the nexus between wildfire smoke and COVID-19. We don't have data yet about that interaction. We will have after this fire season. But we do know that wildfire smoke increases the risk of lower respiratory tract infection in general, not focused on the coronavirus. And as many of you know, there's emerging data with regard to air pollution and of other sources, fine particulate oxides of nitrogen from the usual sources, not wildfires, that suggest effects on increasing risk of COVID-19. So I've been saying, not based on any real data, that I'm very concerned about the nexus of COVID-19 and this bad air quality from wildfire smoke. And what's different about this episode than the previous bad episodes that we had in 2017 and 2018 is the length of time that people on the West Coast have been exposed to bad air quality. We're actually in our fourth, I think there's been over 40 days of what we call spare the air here in the Bay Area, where the air quality is poor and we're supposed to stay indoors.
Could you comment on the water effects of climate change, hurricanes, floods?
Sure. So we went from global warming to climate change, again, to respond to David Egelman, in part because climate change was thought to be politically more palatable than global warming. I'm not sure about that. But climate change also captures the fact that there's extreme weather events as well as just warming. So without having time to talk about some of the meteorology, we do expect more drought, but also more extreme storms, including hurricanes, which are devastating. And the hurricanes don't even have to be that powerful in terms of the wind to cause massive flooding. If they dump a lot of rain, even if the winds aren't at the highest level, they can cause a lot of problem, which Houston and New Orleans have experienced in recent years. And again, that disproportionately affects people of color and disadvantaged. New Orleans, it was the 9th ward that got flooded, and the 9th ward is the only part of New Orleans that hasn't really come back at all yet, and that was almost entirely a Black community. So yes, extreme weather events are part of climate change.
Are wildfires reducing the benefits accrued from the improvements?
A great question from Judy Depew. Yes, the amount of climate forcing from all this black carbon, and actually ozone and oxides of nitrogen are generated from wildfires as well. The climate forcing effects really totally outweigh what we've done this year with regard to our greenhouse gas reduction policies. I don't know the actual data here for California yet, but for the wildfire season in Australia, which was devastating, it was the equivalent, just that, it was like a month or so of wildfires. That was the equivalent of their entire year of anthropogenic greenhouse gas emissions. There's one more from Barry Shea, if you have time for one more.
Yep, good.
Barry Shea was asking, are similar associations with hospitalizations and life expectancy seen in cities where population density and higher air pollution are not as closely tied to lower SES? New York City comes to mind. Well, actually, I think that the areas of lower SES and minority prevalence in New York City also have a disproportionate exposure. But yeah, the air pollution mortality effects like a PM 2.5 and on asthma and cardiovascular healthcare utilization, those occur across the population spectrum. They're just greater effects in communities of color. I think I actually have kind of a hard stop now.
Well, thank you so very much. And this was a great kickoff to the series. And we really, really appreciate your taking the time to educate us. And we hope that the rest of the country can do the same things that California is doing. And thank you for telling us about them.
Well, it was an honor to be the inaugural speaker in Decoding Disparities. Good luck for the rest of the series.
Great. Thank you.
Bye-bye.
Bye-bye.